Good day, my name is Shauna Munson and I'm a student at North Central University. Today I'm going to be discussing available assessments when dealing with marriage and family therapy with military and veteran populations. Whenever a clinician is wanting to assess the needs of an incoming client, it is important that they are aware of available assessment tools to help determine the best course of action for that individual client. When dealing with active duty military, veterans, and their family, it is vital that barriers to communication, positive familial functioning, and individual needs are all assessed. While there are many resources available, it can be overwhelming to know which assessments may best fit the needs of that particular client. Today, we're going to briefly discuss several different assessments that are available in my toolkit and the value each assessment has when working with the military-related populations to help identify the particular needs of that family and/or individual. Assessments that are often used to diagnose PTSD or post-traumatic stress disorder in combat veterans include the Combat Exposure Scale, the PTSD Checklist or PCL-5, the Mississippi Scale for Combat-Related PTSD, the Clinician Administered PTSD Scale or CAPS, the Inventory of Psychosocial Functioning, and the Traumatic Life Events Questionnaire. The Combat Exposure Scale, the PCL-5, the Mississippi Scale for Combat-Related PTSD, and the CAPS assessments were all developed by the Department of Veteran Administration's National Center for PTSD, specifically to measure PTSD symptomology in combat veterans. The gold standard assessment of these is the CAPS. It requires more training to administer than the remainder of the assessments, as it consists of a semi-structured interview and requires an experienced clinician to interpret the responses. The CAPS allow the clinician to make a current diagnosis of PTSD as well as a lifetime diagnosis. The main downfall of the CAPS is the inability to assess for complex PTSD, as it only focuses on one traumatic experience that occurred during the respondent's lifetime. The Combat Exposure Scale, the PCL-5, the Mississippi Scales are easier and quicker to administer, and they can be administered as a self-report or as questions completed with the clinician. When assessing family members of veterans with PTSD, it is important to recognize and assess for the possibility of secondary traumatic symptoms, or STS. STS can be assessed for by utilizing the Psychological Distress Index, the Secondary Trauma Scale, the Zaret Burden Interview, and the Multidimensional Scale for Perceived Social Support, as well as the Child Behavior Checklist. The Psychological Distress Index helps to measure the spouse's psychological functioning within the past year, and it should be noted that spouses who live with someone diagnosed with PTSD score higher on this assessment than spouses who do not live with someone diagnosed with PTSD. There is also a high correlation between higher scores and increased marital problems. The Secondary Trauma Scale is helpful in assessing family members for secondary traumatic symptoms due to the prolonged exposure to someone diagnosed with PTSD. The Zaret Burden Interview and the Multidimensional Scale for Perceived Social Support both help to identify levels of caregiver burden and support. Finally, the Child Behavior Checklist helps to identify internalizing and externalizing behaviors that children experience as a result of living with someone with PTSD and/or other mental health disorders. It should be noted that having higher scores for STS is highly correlated to increased risk of depression, and as a result, it is important for the clinician to assess for depression and other mental health symptoms if a high score is present for STS. Often, when there are identifiable mental health issues, there's an increased risk of underlying substance abuse problems. After assessing for mental health issues, it is important to determine if any of the functional impairment in the family system is a result of alcohol or drug use. The Alcohol Use Identification Test, or audit, is a quick way to assess for possible alcohol-related dysfunction. The screening test is comprised of 4 questions that can be asked to determine if additional questions are needed. Substance abuse can be assessed by utilizing the RAFT tool. When assessing family needs, it is also important to assess for relationship quality, domestic violence risk, and growth. Several assessments are available to assess for marital and relationship satisfaction, including the Quality of Marriage Index, the Relationship Assessment Scale, and the Revised Dyadic Adjustment Scale. These assessment tools are beneficial in determining initial baseline scores as well as progress over time in regards to relationship satisfaction. The HITS assessment can be used to identify possible domestic violence. The benefit of this short assessment tool is that it is 96% accurate in identifying abuse victims and is available in many languages. The last two items in this resource guide are the Family Empowerment Scale and the PTSD Growth Inventory. The Family Empowerment Scale assists clinicians in identifying family support systems and helping them to find new avenues to meet goals by identifying resources outside of their initial thought patterns. The PTSD Growth Inventory allows clinicians to objectively identify areas of growth in veterans with PTSD and to help veterans identify areas of growth for themselves. All of the assessments that have been mentioned in this presentation are generally available online and are useful tools for any clinician to have in their toolbox to promote accurate, efficient, and clear diagnostic decisions and to help provide an individualized roadmap for treatment specific to the needs of that family and/or individual. I hope you have found this information as helpful as I have.